Genetics. Autosomal dominant disease passed to 50% of the children, non penetrance, lack of clinical signs and symptoms despite abnormal genes, spontaneous mutation, new mutation in one of the gametes. तो ऑटोसोमल डोमिनेंट में क्या क्या आता है? अकॉन्ड्रोप्लेजिया, अक्यूट इंटरमिटेंट पोर्फायरिया, अडल्ट पॉलीसिस्टिक किडनी डिजीज, एंटी थ्रोम्बिन थ्री डेफिशिएंसी, ये चार आएंगे. Ehlers-Danlos syndrome, familial adenosis polyposis, hereditary hemorrhagic telangiectasia, hereditary spherocytosis, HNPCC, Huntington's disease, hyperlipidemia type 2, hypokalemia, periodic paralysis. Marfan's malignant hyperthyroidism, Marfan syndrome, myotonic dystrophy, neurofibromatosis, Noonan syndrome. Osteogenesis imperfecta, Peutz-Jeghers syndrome, retinoblastoma, Romanovich syndrome, tuberous sclerosis, VHL syndrome, and von Willebrand disease. Autosomal recessive, these are mainly metabolic. इसमें albinism, ataxia telangiectasia, congenital adrenal hyperplasia, cystic fibrosis, cystinuria, familial Mediterranean fever, Fanconi's anemia, Friedreich's ataxia, Gilbert syndrome, glycogen storage disease, hemochromatosis, homocystinuria, lipid storage disease like Tay-Sachs, Gaucher's, and Niemann-Pick's, MPS, Haller syndrome, phenylketonuria, sickle cell anemia, thalassemia, Wilson's disease, ये सारे आएंगे. X-linked dominant, Alport syndrome, autosomal recessive, Rett syndrome, vitamin D resistant rickets, X-linked recessive, only males except Turner's, only one chromosome, no male to male transmission. Heterozyte female carriers, affected male, unaffected son carrier. तो ये X-linked होंगे. X-linked dominant, Alport syndrome, autosomal recessive, Rett syndrome, vitamin D resistant rickets. Now X-linked recessive में each male child of a heterozygote female carrier has a 50% chance of being affected, while each female child of a heterozygous female carrier has a 50% chance of being a carrier. So X-linked recessive are androgen insensitivity syndrome, Becker's muscle dystrophy, color blindness, Duchenne muscular dystrophy, Fabry's disease, G6PD, hemophilia A and B, Hunter's disease, Leishman syndrome, which increases uric acid, juvenile gout, nephrogenic diabetes insipidus, ocular albinism, retinitis pigmentosa, and Prescott-Albright syndrome. Achondroplasia, mutation in the fibroblast growth factor receptor 3, FGFR gene, childhood syndrome, Patau syndrome, trisomy 13, microcephalic, small eyes, cleft lip and palate, इसमें पॉलीडैक्टिली स्कैल्प लीजन्स होते हैं. एडवर्ड सिंड्रोम में माइक्रोग्नेथिया, लो सेट ईयर, रॉकर बॉटम फीट, ओवरलैपिंग ऑफ द फिंगर्स. एक्टिव जायंट सेल आर्थराइटिस में आप देखोगे विस्कोसिटी, ESR और CRP, उसकी एक्टिविटी का ये है. फ्रेजाइल एक्स सिंड्रोम में यू विल हैव लर्निंग डिफ़िकल्टीज, मैक्रोसेफाली, लॉन्ग फेस, लार्ज ईयर्स, मैक्रोऑर्किडिज्म. Noonan syndrome, webbed neck, pectus excavatum, short stature, pulmonary stenosis. Then Pierre-Robin syndrome, micrognethia, post-displacement of the tongue, cleft palate. Prader-Willi syndrome, hypotonia, hypogonadism, obesity. Williams syndrome, short stature, learning difficulty, friendly, extrovert. Transient neonatal hypercalcemia. Supravalvular aortic stenosis. Cry-to-chat syndrome, characteristic cry due to larynx neurological problems. 5P deletion will be there, feeding difficulty and poor weight gain, learning difficulty, microcephaly and micrognathism, and hypertelorism. Now we come to the other factors of clinical science. DGOT syndrome, which is primary immunodeficiency, which is caused by T cell deficiency and dysfunction. Microdeletion syndrome, deletion of the chromosome 22. Velocardial facial syndrome 22, Q11.2, autosomal dominant, clinical feature, risk of viral and fungal infection. This parathyroid gland hypoplasia, hypocalcemic tetany, thymus hypoplasia, T lymphocyte dysfunction. दो कैच 22 में क्या होता है, कार्डियक abnormality, ट्रंकस arteriosus and TOF, abnormal facies, thymic aplasia, cleft palate, hypocalcemia, hypoparathyroidism, and chromosome 22 deletion. Down syndrome 20 years में 1 in 1500 chances, 30 में 1 in 800, 35 1 in 270, 40 में 1 in 100 and 45 में 1 in 50. Cytogenetics, there will be non-disjunction in 94%, 1 in 100 less than 35. Robertsonian translocation in 5% and mosaicism in 1%. Fabry's disease, this is X-linked recessive, deficiency of alpha galactosidase A. There is burning pain and paresthesia, angiokeratomas, lens opacities, proteinuria, early cardiovascular disease. Fragile X, this is again trinucleotide repeat disorder. Clinical feature, it's seen in males, learning difficulty, large low set ear, long thin face, high arched palate, macroorchidism, hypotonia, autism most common, mitral valve prolapse. Male, female में it will be normal to mild. Diagnosis, you'll do chorionic villus sampling, amniocentesis, CGG repeats, red and southern blot. McCune-Albright syndrome, not inherited, random somatic mutation in GNAS gene, and precocious puberty, cafe au lait, polyostotic fibrous dysplasia, and short stature. Now, Noonan syndrome, autosomal dominant, normal karyotype, defect in chromosome 12, then webbed neck, white space nipples, short stature, pectus carinatum, excavatum, then cardiac pulmonary valve stenosis, ptosis, triangular shaped face, low set ears, coagulation problem. Factor 9 deficiency, examples incomplete penetrance, retinoblastoma, Huntington's disease. Prader-Willi syndrome, genetic imprinting, gene deleted from the father. ठीक है, so and Angelman's gene deleted from the mother. Long arm chromosome 15 पे होता है, microdeletion of the paternal 15q1113, which is 70%, and maternal uniparental disomer of chromosome 15. So clinical feature, hypotonia during infancy, dysmorphic features, short stature, hypogonadism and infertility, childhood obesity, behavioral problems in adults. Williams syndrome again is inherited neurodevelopmental disorder caused by microdeletion of chromosome 7q11.23. Clinical feature, there will be elfin-like feces, learning difficulties, short stature, supravalvular aortic stenosis, transient neonatal hypercalcemia. Trinucleotide repeat disorders, anticipation increases the severity of the symptoms. ठीक है. Fragile X में CGG, Crompton Greaves in a fridge, Huntington's hunt in the cage, CAG, myotonic dystrophy, CTG, Friedreich's ataxia, GA, fridge GA, fragile Crompton Greaves, fridge GA, spinocerebellar ataxia, spinobulbomuscular atrophy, dentorotuberal pallidum, lysium atrophy. Turner syndrome में again short stature is there, primary amenorrhea, only one sex chromosome or deletion of short arm of one of the X chromosome. So 45XO or 45X, there is increased incidence of Turner syndrome. Normal intelligence, short stature, shield chest, wide spaced nipples, webbed neck, bicuspid aortic valve 15%, coarctation of aorta 5 to 10%. Primary amenorrhea, cystic hygroma, high arched palate, short fourth metacarpal, multiple pigmented nevi, lymphedema in the neonates, gonadotrophin level increase, hypothyroidism much more common in Turners, horseshoe kidney most common renal abnormality. Brachial plexus is from the C5 to T1. The foramen of the skull, you have optic canal, sphenoid. इसमें से ऑप्थेल्मिक आर्टरी जाती है और ऑप्टिक नर्व जाता है.